Hello, I'm Dr. Peter Rossi, and I would like to speak to you about peripheral arterial disease. The peripheral arteries are the blood vessels transporting blood from the heart to the remainder of the body, its organs, and the extremities. Similar to the coronary arteries, these blood vessels can become diseased and blocked. This is called peripheral arterial disease. At Pasco Cardiology, we offer extensive diagnosis and treatment for peripheral arterial disease. The first step in evaluating the patient is taking a detailed history of the patient's complaint and performing a physical examination. If it appears that the problem may be related to one of the arteries in the area of complaint, the next step is usually a non-invasive ultrasound and Doppler study, which gives us information about the blood flow and information regarding possible blockages in the area of concern. Frequently, non-invasive ultrasound study alone will give us enough information to make an accurate diagnosis. If further information is needed from a non-invasive standpoint, the patient is usually evaluated with a CT angiogram with contrast or sometimes an MRI. If these studies suggest that the patient requires further treatment, many times the treatment can be done through an invasive angiogram with an interventional procedure such as balloon angioplasty or stent. In the peripheral arteries, this is known as peripheral arterial intervention. The most common sites for peripheral artery intervention are the arteries to the kidneys, which are called the renal arteries, and the arteries supplying blood to the legs. Less commonly, an artery in the arm known as the subclavian artery will need to be treated. If the carotid arteries are significantly blocked, this is usually treated surgically by a cardiac or vascular surgeon. A patient having a peripheral arterial procedure can usually be discharged the same day. In the case of treating blockages to the kidney arteries, the patient will often stay overnight so that the subsequent change in their blood pressure can be closely monitored. The interventional physician has many tools at their disposal. In addition to balloons, these include drug-coated balloons, diamond-tipped burrs that grind calcified blockages into very small pieces that can be carried out by the blood circulation, lasers, stents, and stents covered with a Gore-Tex or similar material, all of which help in achieving our goal of improving the blood supply through the artery. At Pasco Cardiology, all of the physicians are experienced in vascular evaluation. If an invasive angiogram and potential intervention appear needed, the patient is seen by one of the interventional physicians so that angiography and possible intervention can be discussed and appropriately planned. The physicians of Pasco Cardiology are happy to see any patient who has symptoms or concerns regarding a peripheral arterial problem. In the rare event that the patient has an extremely complicated condition requiring the expertise of a major center, we have contacts in the Tampa Bay area, the University of Florida at Gainesville, the Texas Heart Institute in Houston, and other academic institutions around the country that can help. Our goal is the best possible care in what is sometimes extremely complex medical conditions. I hope this information has been informative. If you have concerns regarding peripheral arterial disease, please call the telephone number on your screen to schedule an appointment. Thank you.